Hello and welcome to today's COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. On Monday, the Ministry of Health commenced its administration of COVID-19 booster shots. Minister of Health Dr. Frank Anthony says several studies have guided this process.
There are lots of studies that have been available. I think the very first study that came out showing that you have a weaning of immunity after about 6 months was a study done in Israel. And with that study, which came out on the 17th of July, they had shown that the efficacy of the vaccine weans to about 41%. Then you had other studies that were done, for example, one with AstraZeneca and Pfizer that was published on the 15th of November in medical review. And that shows that AstraZeneca, the effectiveness drops to about 44%. Pfizer drops to about 62.5%. And there are like more than 10 different studies that came out during that period. In addition to that, a lot of the stringent regulatory authorities, such as the FDA, in the United States, would have considered the matter. They have expert advisory panels that will review the data submitted to them, and based on those reviews, would have concluded that a booster dose is necessary. And in the case of the US, after the FDA would have considered it, you have another advisory panel that would review the same data and then advise the CDC. So we have seen the findings from the CDC that basically recommends an additional dose. So if you had a Pfizer or Moderna, 6 months after the second dose, it's recommended that you get a third dose. If you had a J&J, 2 months after the J&J vaccine, you should get another dose. Sinopharm itself has cited studies out of Argentina where Sinopharm was used quite a lot. And from those studies, they too have seen a weaning of immunity. And again, a recommendation from those studies is that you use a third dose. There are other studies in Europe pertaining to AstraZeneca that shows that it weans after 6 months. And there have been studies done in Russia pertaining to Sputnik and studies in the Middle East pertaining to Sputnik. So we have used all of these different studies to come up with the current formulation that we have in terms of giving booster doses.
Persons above the age of 50 years old, those with comorbidities and chronic illnesses, and frontline workers are eligible to get their jabs. When the vaccination campaign started in March, the ministry had put mechanisms in place for shut-ins to get their vaccines, as in teams would have been going door to door. Would the same thing be put in place for the booster shots?
We're working on it right now. We haven't started that as yet because we only started doing boosters this week. So the staff is now getting settled in with administering booster shots, and shortly we'll commence going to those list of shut-ins that we have. We have identified those places, having done the first and second dose in many of those homes. So we'll be reaching out to the respective agencies and putting the arrangements in place so that we can do the booster shots.
The health minister disclosed that the country is also expected to receive more vaccines soon.
We have a number of vaccines in the pipeline. We're expecting another set of Pfizer for adults coming in early December. and we have some other vaccines that we'll get in the first quarter of next year, which includes Pfizer, AstraZeneca, and J&J.
Here is an update on the country's COVID-19 vaccination status.
So as of yesterday, we have completed 397,612 doses for adults. This is first dose. That's now about 77.5% of our adult population. And second dose is 272,701 person. This is now approximately 53.2% of our adult population that would have received a second dose vaccine. In terms of the 12 to 17 age group, first dose, we have completed 28,874, that's 39.6% of the age cohort. And second dose would be 20,075 persons. That's about 27.5% of that age cohort receiving a second dose.
That's it for today's COVID-19 update. For more information, visit our website dpi.gov.gy or health.gov.gy and our social media platforms.